scalp appears to be healthy overall. No concerns with that. Okay, so if it's all right with you, we'll go ahead and move on to the abdominal examination. So what I'm going to do is move your shirt slightly upwards, just exposing the abdomen. I will also lower your shorts. I'm going to go ahead and cover you. Just provide you with a little bit of modesty, so I'll just be undoing the top button here. I'm going to fold these in and just comfortable for you. Just taking my pen light and having a look at the skin overall. Okay. Do notice a small mole there. To be normal in texture and color, slightly raised, but margins are normal. Okay. It does appear that you've had your belly button pierced at one point. Not noticing any signs of scar tissue. Just having a closer look at the umbilicus. It does appear to have healed normally into adulthood. I'm not noticing any signs of umbilical hernia. And hair distribution is normal and even throughout. No signs of excess feminine hair growth or any signs that could lead to an abnormality in your hormones, which is good. Okay. So, I'm going to begin by listening to your stomach. So I just have my stethoscope here. And it is a little cold, I apologize, but you're going to feel me place this on your stomach in various positions. Make sure to listen in all 4 quadrants. Listening to the large intestine as well as the small. Bowel sounds are normal and active. No signs of overactivity. Blood flow appears to be normal. So let's go ahead and move on. I want to do just a couple of measurements here. Checking for any asymmetry in the umbilicus. And of course, these measurements assist with being able to record your BMI. Okay. Okay, so let's move on to some palpations of the abdomen. So you're going to feel me very gently at first. Palpate around. going to go a little bit deeper. Let me know if any of this causes you any discomfort. Making sure to palpate around the umbilicus or belly button. Again, checking for any signs of umbilical hernia. You're going to feel me palpate slightly deeper. Checking for any palpable organs such as your kidneys, spleen, liver, none of which are palpable, which tells me there's not any signs or symptoms of inflammation. Listening for a hollow sound above the umbilicus, present and normal. Let's go ahead and move on to a series of brief sensation tests. Should be able to feel that this is soft. Throughout. Sharp. Okay. Checking for any loss of sensation around your scar tissue, but I don't notice any. I'm getting a normal reaction around the umbilicus, which is good. So I'm going to move on to of a more prominent test, so testing your sharp sensation. Just looking for signs of normal reaction, which is present. You can see the flexing of the abdominal muscles. Again, seeing normal flexing of those accessory muscles. Might be testing for cold temperature sensation, so this should feel very cold. Very good, okay. No signs of abnormality here. Just want to make sure again we're getting a normal reaction in those accessory muscles here. Okay, so let's go ahead and get started. I'm just going to start with the visual inspection. So just taking my pen light and having a look at your stomach, looking at your breathing as well as your skin. So far, everything appears normal. I do have a couple of freckles, but they look fine. They're not raised or asymmetrical in shape. Skin color and texture is normal for age and ethnicity, which is good. And you do not appear to be dehydrated.
Okay.
Umbilicus appears normal. Doesn't appear that you've ever had your belly button pierced.
Never.
And I'm not noticing any sense of complication at birth, so that's good. No visible stretch marks or any other abnormalities of the skin. Okay, so overall you look healthy. Let's go ahead and get started with some palpation. So again, I'm going to be using 2 to 3 fingers, and you will feel me kind of gently at first, pushing around on your abdomen, okay?
Yep.
So just getting started with a few gentle palpations. Soft and tender, not noticing any abnormal firmness or any signs of bloating. Just going to feel at the base of your breastbone, which appears to be intact, and I am able to palpate your ribs normally. Any pain or tenderness here? And are you having normal bowel movements? When was your last bowel movement?
This morning.
And it was normal, no diarrhea or anything? Okay. And are you ever constipated? Definitely not noticing any signs of bloating, so your diet appears to be working for your digestive system. So now you're going to feel me palpate a little bit deeper, and this time I'm feeling for your organs, okay? This might feel a little odd. For your intestines, which are normal. I'm going to be pulling up here, palpating a little deeper, just looking for any signs of umbilical hernia, which would be a hernia below your belly button, but I'm not noticing that. Okay. So I'm going to take my stethoscope and have a listen to your bowels. It's going to be a little cold. Okay, so bowel sounds are active. Can I have you breathe in deeply and then hold your breath for me?
Okay.
And release. And one more time. And release. Very good. Okay. No issues there. Bowel sounds are normal. You appear to be digesting your food normally, and I'm not noticing any other abnormalities. So I am going to take my reflex hammer, and you'll just feel me do kind of a light tap along your belly, okay?
Okay.
I'm sure you can hear that hollow sound is what we're looking for.
Okay.
Very good. Okay. And then is there any pain or tenderness as I kind of percuss along your rib cage here?
No.
Okay. And here. Okay, very good. So for the last portion of your abdominal exam, I'm going to be performing a sensation test. So I'm just saying if there's any issues with sensory loss or any abnormalities from one side or the other that could indicate a neurological dysfunction, okay?
Okay.
So to start, I have just a cotton wisp here. It's gonna feel like this. I'm gonna run it along your stomach. At first, you don't have to say anything. I'm just looking for a normal reaction in your muscles, okay?
Mm-hmm.
So it might tickle just a little.
Mm-hmm.
Perfect, okay. So now if you can, I'd like you to close your eyes, and as you feel it touch your skin, I just want you to say yes.
Okay. Yes. 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 Yes.
Perfect. So we're gonna do the same thing. This time you're gonna feel this side, which is a little sharper.
Mhm.
So just say yes when you feel it.
Yes. 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 Yes.
Okay, sorry, I know that is pretty ticklish.
Tickles.
So this time we're gonna alternate sides.
Okay.
So this will be soft and this will be sharp, and you just indicate which side you feel.
Okay. Soft. 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 Hard. Harder. Harder. Soft. Soft. Hard. Hard. Soft. Soft. Hard. Soft.
Very good. Okay.
Did I get this right?
You got all of them right. You did very well.
It's a little hard.
So moving on from that, we're gonna do something similar. This time I have what's actually an acupressure tool, but you're gonna feel me just press it into your skin. I might do it softly, I might do it a little deeper, just say yes if you would.
Okay. Yes. 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 Yes.
Very good. Now this test is a little bit harder. If you don't get it correct, it's okay. Can you feel the difference between this point and this one?
I don't know if I can feel it.
So one is just a little more surface area. So this one is smaller and this one is larger.
Okay.
So this will be 1 and this will be 2.
Okay.
If you can't tell the difference, don't worry about it, okay?
Okay. 2. 2. 2. 2. 2. 2. 2. 2. 2.
Okay. That's okay. That test is very difficult, so you weren't able to tell, but that's all right. So we're going to move on, and this time I'm going to be using what looks like a pair of tweezers. So I'm going to do a light, very gentle pinch, and I want you to just say yes if you feel it.
Okay. Yes. 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 Yes.
Very good. No issues with that. All right, Katie, so let's go ahead and move on. So this time I have a little brush, and I'm going to brush this along your stomach, and you just say yes if you feel it. I will warn you, this one is usually tickling people, so just want to let you know.
Yes. 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 Yes.
Very good. So I did get a normal reaction there. And now I'm going to move on to the Wartenberg wheel, which is probably the most ticklish of the bunch. So it is pretty spiky. It's not going to hurt you, but it is a very distinct sharp.
Okay.
So you'll feel me run it along your skin. I want you to tell me if it feels any differently from one side to the other. So I'll do it on one side and then the opposite, and you just let me know if it doesn't feel the same.
Okay.
So this side compared to this side, does that feel the same?
Yeah, it tickles more right here than
More on this side, okay. And here, and here,
same.
same. Here, and here. And then if we do top, bottom,
Same.
and then kind of midline, top, bottom.
Same.
And over your belly button is not any more sensitive than anywhere else, correct?
No.
More ticklish here
Yeah.
on the sides, I would imagine,
Yeah.
compared to here.
Yeah.
Okay. Very good. So now I'm going to use an object that's fairly cold. Can you tell that that's cold?
Yeah.
So I just want you to say yes if you feel it.
Okay.
And if it gets any warmer,
Yes.
anywhere on your stomach.
Yes. 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 Yes.
Perfect. And can you feel vibration here?
No. I don't feel vibration. I feel you touch me though.
Do you feel vibration here?
Yeah.
Here?
Not really.
No? But you feel that it's cold?
Yeah.
Okay.
I felt vibration that time.
Okay. So you feel this, and it stops as it touches you?
Yeah.
Okay, that's fine. So you're just a little more sensitive in your hands than you are in your belly, but you are able to feel it, so that's okay.
Okay.
And then the last thing I want to do is I'm going to use the end tip here, and you don't have to close your eyes. I'm just going to run this along the middle of your stomach, and I'm just looking for a reaction in your muscles, okay?
Okay.
It's reacting, so use this side. There we go. So getting a normal reaction there. Very good. Okay. So let me just jot down a couple of notes here, and we will go ahead and move on to your pelvic exam after this, okay?
Okay.
So I didn't notice any abnormalities in your abdomen. Bowel sounds were normal, sensation test was perfect. You missed a couple, but they're nothing that would be considered abnormal.
Okay. It was a kind of hard test.
It is kind of difficult. You don't, you get touched in your stomach, but not in that way by other people, so it can be kind of odd. It's hard to tell the difference as far as when I do it on your hands, you're more likely to know what it is, but on your stomach it is difficult.
Yeah.
Okay. Alright, so I am going to go ahead and get set up for your pelvic exam. Now, as far as atmosphere in the room, I did want to get it set up to your preference just so you can be comfortable, because obviously it is an invasive exam. So when you filled out your appointment card, you did say that you preferred pink or purple light, so I will accommodate that. You asked for dim lighting with a candle, which I do have, and then you wanted a melon scented sachet, which I do have, and I will give to you before we get started, okay? Okay. So let me get all of that set up for you, and then we will come back and we'll get started, and I'll explain the rest of the exam.
Okay, thank you.
Perfect. So the next portion of the exam is going to be abdominal.
Okay.
So I will be having a look at your stomach.
Yep. Can you take my shirt off, or?
I will lift it up for you if that's all right, or we can just lift it up to your chest, and then I'll make sure you're covered down here with this sheet. So just like that should be fine.
Okay.
And then we'll just kind of tuck this in. Is that okay like that?
Yeah, it's fine.
Perfect, okay. So first what I'm going to do is just have a listen to your abdomen.
Okay.
Definitely want to listen for any excess bowel sounds, any overactivity of the bowels, blockages in your intestine, anything that could indicate like a small bowel obstruction.
Yep.
When is the last time you had a bowel movement?
Yesterday, last night, I guess it was last night.
Okay. And is that normal for you?
Yeah, it's usually weird, but it's like between 9 and 11. I think I go to the bathroom like one more time.
So most people's bodies do adapt to a schedule, and you start to go at the same time every day. So that's good that there's not been any changes with that. Bowel sounds are normal.
Okay.
I'm hearing normal activity. It does sound like you're digesting some food now. You've eaten within the last 5 hours?
Yes.
Okay. Good. So I'm just going to place this directly over your belly button, just listening for any umbilical growths. Can I have you breathe in deep, hold the air in your belly?
Yep.
And release. Very good. And while I have this out, I'm just going to do some light percussing.
Okay. What does that do?
So that was just kind of percussing your intestines to
Okay.
see what feedback they give me, listening for a hollow sound. So
Okay.
anything that might sound rigid or stiff might
Yeah.
indicate a bowel obstruction, which would
Okay.
mean you have stool
Like
sitting
blocked.
that's not passing through.
Okay.
Yeah, so no indication of that. So let's do a quick test for symmetry. I just have a ruler here.
Yep.
And I'm just going to be making sure that you aren't experiencing any abnormal bloating or swelling. Do you feel bloated more than usual?
Not really, no.
Okay. Okay, so you're fairly symmetrical from side to side. Just gonna take my calipers. Can I have you breathe all of your air out, protrude your belly as much as you possibly can? And now bring it in as far as you possibly can. Good. So do that one more time, out, out, out. And go in as far as you can. Good, okay.
Yep.
That is all normal. So the next thing I'm going to do is test for reactivity of your skin.
Okay.
So you're going to feel a slight kind of pinching with my tweezers. It shouldn't hurt, but you definitely will feel it. You don't have to do anything here. I'm just testing for normal reactivity in your muscles. So this basically sends a signal to your abdominal muscles, and we're seeing that normal reaction. And then this might be a little uncomfortable. I'm going to very slightly tug on the hair here. Good. Okay. All right, Anthony. So if it's all right with you, let's go ahead and move on to a brief sensation test.
Okay.
And just looking for normal sensation of the abdomen. So I'm going to do that by testing a couple different tools here. So for the first one, I do want you to close your eyes. Tell me when you feel this soft sensation, okay?
Yep. I feel it. Feel it. Feel it. I feel it. Felt it.
Good. And now when you feel sharp?
That's sharp right there, yep. Feel it.
Good, okay. I apologize, I know it's ticklish.
Yeah, sorry.
So I'm gonna do a very brief, sharp or dull. I want you to just tell me which one you feel.
Sharp. Wait, I would say that was sharp. The first one was kind of dull.
Good.
Dull. 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 Sharp. 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 That was dull.
Good.
That was dull.
Okay. So there were just a few that you got incorrect, but you
Yeah.
were able to guess it
Yeah.
the next time around. Okay, so this next one is a little scratchy but still soft.
Okay.
So I want you to just say yes when you feel it.
Yes. Yep. Yes. 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 Yes.
Any difference between this side and this side?
No.
Okay. Very good. So the next one I'm gonna do is this light brushing.
Okay.
So this is gonna rule out any signs of neuropathy. I want you to tell me if this feels abnormal, any stinging, burning, anything like that.
Okay. No. No. No.
Okay.
Felt normal.
And this one is called a Wartenberg wheel.
Okay.
It's fairly sharp. I'm gonna run this along your belly in different directions. I want you to tell me if the sensation changes from one side to the other.
Okay.
So ideally it would feel the same bilaterally, which means both sides should feel the same.
Okay. Feels the same. Feels the same.
Okay.
Feels the same.
And here is the same.
Yep.
All around the umbilicus is the same.
Yep.
Perfect. And if we go horizontally, that's the same.
Yep.
Good.
Yeah, I think my stomach's like used to like the sensation, so it
Yes,
keeps like
I'm
contracting.
sorry.
No,
That's
sorry.
good though. So we're getting normal reactivity in the muscles of
Uh-huh.
your abdomen, which is what we want to see.
Okay.
If there was a lack of reaction or even an overreaction, then it could indicate a bigger
Okay.
problem. So totally fine. So I'm going to do some just percussing here. Again, just listening to the 4 quadrants of your abdomen.
Mhm.
So you can tell that this here sounds different than this,
Yeah.
and that's what we want to listen for. I'm going to do one here just on your breastplate, and then along your chest wall.
Mhm.
Can I have you say 99 every time I tap?
99, 99, 99, 99,
And here.
99, 99, 99, 99.
Good. So the last reflex test I'm going to do on your abdomen is I'm going to have you close your eyes, and I'm going to run something along your stomach,
Mhm.
and I want you to just let yourself react normally.
Mm-hmm.
Good. Okay. I know that's very ticklish, but we
Yeah.
did get a good reaction there.
Good, good.
So the last sensation test I'm going to do here is just have you tell me if this
Okay.
feels cold.
Yeah.
Does this feel warm?
Yes.
Okay, so just tell me cold or warm.
Okay. Warm. Cold. Cold. Warm. Cold. 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 Warm.
And same coldness all the way across
Yeah.
here. Okay, thank you.
Yeah.
So I'm going to do some deeper palpation
Okay.
now. So you're going to feel me press in. Tell me if any of this gives you any discomfort or
Just a little bit there.
little bit
Yeah.
discomfort here.
Yeah.
Here,
Not so much. No. A little bit
a
there.
little bit here.
Yeah.
Okay, so I am feeling some slight bloating in your
Yeah.
lower abdomen.
It's like sometimes I feel the pressure.
Okay.
Yeah.
How how's your water intake been in the last few days?
It could have been way better, honestly. I think sometimes I was overcompensating, like the Gatorade.
Okay.
But I know I should drink more water.
Okay, so that makes sense if you've been drinking more Gatorade than
Yeah.
water. It's there's definitely a little bit of swelling here, which
Mhm.
could be the salt intake. Gatorade is pretty high in sodium.
Yes.
And if you haven't been drinking water, so you're dehydrated and you're also retaining water, which
Okay.
explains the bloating and why you're a little uncomfortable here.
Mhm.
You're just a little full. So I would hold off on the Gatorade,
Yep.
lighten up on the sodium intake, whether
Mhm.
that's food or drink. Definitely drink some more water.
Mhm.
Try drinking some lemon water.
Okay.
I'm not too concerned because you are having normal bowel movements. Bowel
Yeah.
sounds are normal. But I do want to make sure that we're preventing any further damage. So
Mhm.
I'm going to guess that this is likely a food poisoning incident.
Okay.
If it were a virus, I would think you would be having more diarrhea,
Yeah.
more vomiting, because your body is not going to get rid of the virus until you expel all
Mhm.
of it, unfortunately. With food poisoning, normally the sicker days come within the first 1 to 3 days
That's
after you
right,
consume
yeah.
the food, and then it kind of tapers down after
Yes.
that. Whereas with a virus, it'll kind of last all throughout until it's completely done. So I'm guessing that this is a food poisoning incident. Unfortunately, you don't know what it was, so I would just be careful with where you're eating.
Yeah.
Likely wasn't something you had at home. Most people don't get food poisoning from
Yeah.
their own kitchen.
Would undercooked food give you food poisoning?
Absolutely, yeah.
Yeah. I think I had some. I get chicken from my job, but I don't think it was like it wasn't hitting the.
Maybe not fully cooked. Okay.
Yeah.
And chicken, unfortunately, is one that has to be cooked completely to
Yeah.
160 degrees.
Yeah.
Otherwise, you're looking at risk of salmonella, botulism, that kind of
Yeah.
thing. Okay.
Yeah.
Okay. Was it dark meat chicken by
Yes.
chance? Okay.
Yeah.
So dark meat is harder to tell because it's kind of
Dark,
pink
yeah.
throughout. So even if it's fully cooked, it still has a pink tinge. Versus if you're eating like a breast or white
Okay.
meat, you can tell whether or not it's fully cooked.
Yeah.
So definitely something to look out for. Also, undercooked chicken has a specific smell
Okay.
versus if it's fully cooked.
Okay.
So just something to keep in
Oh,
mind.
definitely.
And you did say that other people at work were sick as well.
Yeah,
So they probably
could've-
likely ate the same
yeah.
thing. Okay.
It's all making sense now.
Okay. Of concern today, so I think we're good to go as far as the breast exam. So that's wonderful news. So let's go ahead and move on to your abdominal assessment. And like I said, I just want to have a brief look at your abdomen, make sure that there's nothing concerning, no signs of inflammation in your pancreas or anything like that, okay? So I am just going to slide this down. Okay, so I'm just gonna tuck this underneath your belly button, and we only need just a little bit of exposure here, enough for me to just have a look at your abdomen. So I'm gonna start with some auscultations. So I'm going to use my stethoscope to listen to your heart as well as your belly. Make sure that everything sounds healthy and is functioning within normal limits. So this is very cold. I do apologize. I want you to just take a couple regular breaths for me to start, okay? So far, everything sounds normal. Okay, so not hearing any cause for concern there. So I'm going to move down and listen to your abdomen now, okay? So again, just take normal breaths for me. Perfect. Good. Okay. So have you take a deep breath in for me. gonna listen right over your belly button, and I'm listening for any signs of umbilical hernia. So I'm just gonna pull this down slightly here so I have a little bit better access. I'm not hearing anything concerning here. Good, okay. So all of that sounds healthy. So I'll go ahead and put this away. And we can move on with the next portion of our examination. So I'm going to start by just having a look with my light, just like I did to your hairline, just having an overall look, making sure nothing looks abnormal there, okay? Just using my light to cast a natural shadow here, looking for any signs of anything that could be protruding, any signs of abdominal hernia, anything like that. And it does look like at one point you had your belly button pierced. Is that still an active piercing? Not anymore? Okay. Do you know if the hole is open or has it closed?
I'm not sure.
Okay. I'm going to just have a look and see if there's any signs of infection or anything there, okay? When is the last time you had a piercing in place?
A long time
A
ago.
long time ago.
Yeah.
Okay. So at least a couple of years. So it does appear that as though the piercing might still be active. I definitely would be careful if for whatever reason you do decide to insert a piercing. It could be closed in the very center, so I don't want you to hurt yourself, but it does appear as if it might be still active, okay? It is still open on both the opening and the closure. No signs of infection or anything otherwise abnormal there though. I'm also not noticing any scar tissue, no signs of keloid or anything like that. Okay, and the belly button itself does appear healthy. There's no signs of excess debris or anything like that. Skin itself is well intact, smooth. Nothing notable or concerning here. Okay. So I am going to move on to some gentle palpations. So I'm just going to be using 3 of my fingers to palpate around your abdomen here, okay? So starting here, gently feeling on top of and underneath your rib cage. Any pain or tenderness here?
No.
Okay. Good. And on this side, no pain or tenderness here?
No.
Good, okay. So just starting off with a gentler palpation. Okay, so all of that feels normal. So now I'm going to go in with a little bit of a deeper palpation here. This time I'm feeling for your organs. Okay, so I'm not feeling any signs of excess inflammation or anything that would indicate any abnormality within your organs. All of that feels completely normal, okay? So the next thing I'm going to do as far as your abdominal exam is just do some gentle percussion. So I have a couple different devices here that I will be using, and it's just kind of a gentle tapping to just kind of feel around, listening for any signs or symptoms that there could be an abnormality there. So far that sounds normal. Any pain or tenderness in the belly here?
No.
Again, the belly button here. No pain or tenderness here. Okay, good. going to repeat that test with a very small hammer, and this is going to do the same thing, just very slightly different. This time I'm going in a diagonal motion. Good. Okay, and then again along the ribs here, there's no pain or tenderness. Good. And nothing along the belly button here. Good. Okay. So the last thing I'm going to do for your abdominal exam is just a very brief test for normal sensory response. So you don't have to do anything. I'm just looking for a natural neurological function. Basically, you have reflexes in your abdomen that will flex a certain way, reflexes in your skin, and I'm just looking to make sure all of that is intact based on what stimuli I produce on the skin, okay? So just close your eyes for me, allow yourself to react naturally. Good. Good, so I am seeing that action in the muscle there, doing very well. Good, I know it's a little ticklish, you're doing great. Good. I'm going to do that with my second tool. So testing for temperature variation here. Perfect, getting a great response. I'm going to go ahead and test that with a different tool. All of that had a normal neurological response, and I don't see why there's any cause for concern as far as your breast exam or your abdominal assessment. I would say we could probably go ahead and move on to the examination of your back. So I will have you turn around onto your belly, and then we'll assess your back, okay? Okay, very good. All right, Isabel, so at this time I am going to go ahead and move on to the abdominal assessment. So you just go ahead and relax. I'm just going to have a look at your belly as well as your pelvis. I might manipulate your clothing just slightly to kind of give me a little bit more of a viewing area. You just let me know if any of it causes you any discomfort, okay? Okay, perfect. So just to start off with, I'm going to go ahead and expose a little bit of a wider area here. So just bringing your top up to about the rib wall so that I can expose your rib cage here and have a better look, and then as well as very slightly pulling down your bottoms so that I can have a look at the umbilical area as well. Perfect, okay. So now that I have good visualization of the area as a whole, I will go ahead and start with my assessment. So I would like to just have a look kind of overall, notating any changes or abnormalities in the skin texture. So skin appears smooth as a whole, not noting any areas that are abnormally bumpy or anything that could indicate an underlying inflammatory condition such as psoriasis or eczema. You can see a very small mole here that I will have a look at more closely. As a whole, your skin is very clear. It does appear that you had a belly button piercing or an umbilical piercing at one point, so I will have a look at that. So, just pulling the skin slightly taut so that I can have a look underneath, noting any visible veins. Also noting the curvature of your rib cage on both sides, checking for symmetry there. Of course, having a look at the umbilicus here, noting any possible abnormalities externally, but I don't see anything there. So I'm going to go in with a little bit of a different light. So this is just a variation of a pen light, and it's just going to allow me to have a bit of a closer look at your skin. So I'm going to begin by shining it kind of directly here so that I can just have a look at the overall skin integrity. Nothing of note here as far as I can tell. Skin texture is very normal. Everything looks healthy. It does appear that you are slightly cold as I notice some goosebump here, but that's okay. And then just having a little bit of a closer look, excuse me, while I just get slightly closer here. I just want to look at this mole. So it's not raised in texture at all, which is a good sign, and color is normal and consistent with your natural skin tone. So what we like to see with moles is that they're only a couple of shades darker than your natural skin tone. It does become a little bit worrisome if they are black around the edges or darker than what we would like to see. So as far as I'm concerned, this is not anything to worry about here. Like I said, it's not raised away from the skin at all, and while the edges are slightly abnormal, it's nothing that I would say is concerning. It does have a circular kind of oval pattern to it, which is good. So I wouldn't guess that that's anything that we need to worry about. So I'm going to have a little bit of a better look at this belly button piercing, and I did see in your chart that you said this was no longer an active piercing, so at this point we wouldn't really be worried about any signs of infection as it has been closed for some time. I do just want to make sure that there's no signs of abnormal scarring or keloid thickening of the skin, anything like that, which I did not know upon visual inspection. Have a little bit of a closer look here with my brighter light, and I'm not noting anything abnormal here. Also, it does not appear that the piercing is active, meaning that it no longer goes from the opening to the closure. It does appear that the scar tissue has closed it throughout the middle. So if this was a piercing that at any point you wanted to use again, you would likely have to have it re-pierced, okay? All right, so let's go ahead and move on to some palpations of your abdomen. So what I would like to do at this time essentially is similar to what we did with your chest and clavicle area. So I'm just going to push this down a little further and begin by having a look here. So looking for symmetry in your breathing. So when you breathe in, we'd like to see even rise on both sides of the abdomen, which I am noting. So just watching a couple of your respirations, making sure that I'm not noting any abnormality there. And all of that does appear to be within normal limits. So what I'm going to do actually is go ahead and have a listen to your abdomen. So I'm just going to go in with my stethoscope, and it is a little bit cold, I do apologize, but I'm going to place this on various areas here and just have a listen to your stomach. So I'm going to get just a little bit closer here and just kind of gently place this down so that I can hear your abdominal sounds, and listening for normal activity in the colon. Also listening to make sure that your intestines appear to be functioning properly. So we would like to hear some activity in your bowels. Making sure that everything sounds okay and that I'm not hearing any overactive bowel sounds, which could indicate something wrong with your endocrine system, but I'm not noticing that so far. It doesn't appear that you have any underlying diseases such as Crohn's or any other abnormalities with your stomach and your digestive system. All of this does sound very normal. Then I am just going to place this directly over your belly button. I'm just listening for any signs of umbilical hernia. If there's any more opaque areas that I'm not able to hear, but that does sound normal as well. Very good. Okay. So lastly, just going to flip over to the bell side and have a listen one more time. Good news is that all of that was well within normal limits, so nothing to worry about there. Just gonna go ahead and put my stethoscope back on its holder. And I am just gonna go ahead and notate that your abdominal auscultations were normal. Bowel sounds were active, but within normal limits. I did not note any overactivity. Okay. All right, so let's go ahead and move on here. And as I stated before, I'm just going to be doing some palpations of this area. So I'm just going to start by palpating around your rib cage here. So I'm just going to first kind of map out this area And just feeling for the protrusion of your ribs here. So this is a very natural kind of line of demarcation that's notable here along your rib cage as well as on this side. And I'm just kind of placing my hands in a motion that allows me to go underneath so that I can feel the ribs more easily individually. So I'm just going to be palpating along, and this might be slightly uncomfortable, but it shouldn't cause you any pain. Okay, and then being sure to palpate along the edge here. Good. So do that on the other side as well. You're doing great. All of that appears to be normal. I'm not noting any inflammation on either side, and they do appear symmetrical in shape as well as where they end on your abdominal wall here. So the quadrants of your abdomen, they end at right about the same spot, which is what we like to see. So what I'm going to do now is just come a little bit closer here so that I can palpate along your chest wall down to the sternum. So just palpating down this area, putting a little bit of a deeper pressure in between the rib cage. And I'm going to follow that all the way down to your umbilicus. And there's a notable change in texture along your chest wall as we come down. So the further down we come, the more fat deposits you have in your abdomen, which is totally normal. We just like to see that there is a change in the fatty tissue here versus here. Good. Okay. So I'm going to palpate now coming from the outside, working my way in. Good, and now top to bottom. Good. Perfect, okay. So I'm going to go ahead and palpate directly along your belly button now. And I'm just going to hold the skin slightly taut here and just palpating around in a circular motion, making sure that I'm not noting any further signs of umbilical hernia. All of that does appear to be normal. No notable abnormalities in texture. All right, Isabel, you're doing really well. So what I'm going to do at this time is proceed with some more percussions of your abdomen. So using the same tool that I used along your chest wall, just going to be percussing essentially the same way, Just listening for any abnormalities in sounds with auscultation here. So first, working along the rib cage. There's of course a notable difference in sound in the more bony prominated areas here. So there's more bony prominence, the sound is more kind of hollow versus when we get to these higher fat concentrated areas, the sound is a little more dense, which is what we like to see. Okay. All of that was well within normal limits. I think what I would like to do at this time is move on to some palpations of your pelvis. So what I'm going to do is, I guess I can leave your pants where they are. I'm just going to bring down this fold. I'm just going to be palpating along the pelvic bone here. So just looking for any abnormalities in the pelvis itself. So your pelvic bone protrudes to the very top portion here, and then as well as the bottom portion of your abdomen. So just making sure that all of that is symmetrical and normal from one side to the other, making sure there's no notable signs of asymmetry, anything that could indicate either a dislocation of your pelvis or maybe just something that would indicate that you would need a realignment, which would be taken care of by a chiropractor. But so far I'm not noticing that. So what I'm going to do now is do just a little shimmy of your pelvis. And this is just going to further allow me to note any signs of dislocation. And all of that was normal. So I'm just feeling right above the bladder and looking for any signs of possible inflammation or enlargement. So looking for any signs of enlargement in the bladder itself, which I'm not noting. It does appear to be normal in size and shape, and I'm noting rounded edges, and its placement is kind of midline belly button to pubic area, which is what we would like to see. So now I'm going to move up to palpating your other organs. This is a little bit of a deeper palpation. So all of that was normal, and I do just want to note. Okay. So palpations are all normal limits, bladder midline to pelvic region. No notable differences with your pelvic bone. Everything appeared to be in place. percussions of your rib cage were also noted to be normal. Okay. All right, Isabel, you're doing great. So we are going to move on to the next portion of your abdominal assessment, and I do just want to take a couple of very brief measurements for symmetry here. So essentially we're just measuring to see that the distance from certain points on one side are normal in comparison to the other side, okay? So since I have your shirt pulled up pretty equally from one side to the other, I'm going to use this as kind of a base point here. So measuring here. Okay. Comparing that to the other side. Good. And then I'm going to measure the widest point, which we can see is just very slightly longer, so about 8.5 inches there. I'm also going to measure the distance from your belly button to your bladder, as well as just the length and width of the belly button itself. Okay, now noting the rise of your abdomen here, I'm going to go ahead and measure from the shallowest point. Good. As well as the width, the widest point here. Perfect. Okay. Good. Okay, so in keeping with the measurements, I'm going to move on to using a different device, and these are called calipers, and essentially I'm going to use this to perform the same thing. I'm just measuring one side to the other. These are very cold. I do apologize. It is a very cold metal, so it might be just a little bit startling here. So I'm going to start midline to kind of the edge of your rib cage here. And then compare that to the other side. Good. I'm going to perform that as well in the lower quadrant, as well on this side. I did notice a very slight difference here, so a slight offset from the center on this side, but it's not any more than about 1/2 inch, which is okay. So again, measuring the distance here. Okay. Perfect. So what I'm going to do now is I'm just going to take this tongue depressor, and essentially it's just a wooden stick that I'll be using to once again assess the texture of your skin as a whole. So what I'm going to do is just use this as a kind of a tool to help me pull the skin, push slightly taut here so that I can have a look at the overall texture of the skin, assessing for any abnormalities in skin texture. So because the wood is so smooth, it will catch on any areas that are not as smooth. So it really just allows me to know anything that I might have missed with my eye. Okay. looking to make sure that the mole is in fact not raised. Good. Okay. While I have this tool out, I am going to be using its length to measure the depth of your umbilicus or your belly button. And the purpose of this examination is to measure how far your belly button essentially goes and note any possible abnormalities there. So there is an average length that we like to see in adult females, and that's what I'll be testing, okay? So just going to literally insert this into your belly button and just going to note just want to make sure I get an accurate reading here. So just noting depth here. I will go ahead and measure that, and you are about 3/4 of an inch. Great, so I will go ahead and quickly notate that. Okay, so about 3/4 inch. Perfect, okay. We are going to go ahead and move on to your abdominal assessment. So give me just a second while I get that set up and we will get started, okay? Okay. All right, Isabel. So now that we have you all settled and ready for your abdominal assessment, we will go ahead and get started. So is it okay if I go ahead and pull back your sheet? Okay. So I'm just going to pull this back just enough to expose your abdominal cavity here. And just be folding this over a little bit. So similar to the examination of your face, we're performing a visual assessment and then we'll get started with the physical portion of your exam, okay? Just folding this over. Okay, so also going to be exposing your belly, so I'll just pull your shirt up a little bit if that's all right with you. And you're welcome to just relax your arms in whatever way is comfortable. Do you want to place this arm at your side? Yep, that's fine. Perfect. And I'll just go ahead and fold this over here so that just your abdominal cavity is exposed and very slightly pulling down your paint in an effort to expose the umbilicus here. So we can go ahead and get started with your assessment and perfect. Okay. Okay, so let's begin by performing a bit of a visual assessment. So I'm just going to have a look at the overall integrity of your skin. So looking for any signs of abnormality in skin texture, any signs of erythema, which would be like a pinkish red rash, sometimes blotchy but usually isolated, so not seeing any signs of that here. And skin appears clear, no signs of excess stretching of the skin or anything abnormal there. Also having a very brief look at the umbilicus to start looking for any signs of abnormality here in either shape or depth, which we will be measuring shortly. It does appear that you have a piercing, and it doesn't appear that this piercing is active, so you must have had it closed for some time. Okay, so I'm going to start by having a look with my pen light. So just beginning with a visual assessment, having a look with my pen light, looking for any more obvious signs of abnormality that weren't noticeable to the naked eye. So having a look and notating any possible abnormalities, which I'm not seeing so far. The skin does appear very clear in texture, normal color variation throughout. Okay, so just having a bit of a closer look at the umbilicus here and noting any signs of abnormality in the piercing, mainly any scar tissue. So what I'm going to do is shine my light from one end of the piercing to the other. And I am seeing actually a fair amount of light. So that could indicate that your piercing is actually active. I know you said that it had been a while since you actually put a piercing in it, so I would be cautious before putting anything in there just to make sure that it is open. But it doesn't appear that it has fully closed, so just something to note. Okay, so let's go ahead and move on, and I'm going to be performing a couple palpations. So just like we did on the cranium, just using my hands to gently palpate around the abdomen here, okay? So you let me know if this causes you any pain. I'm going to start by palpating around your rib cage. And at first just doing a very gentle depth, not going in too far, just measuring around the ribs, looking for any signs of abnormality here. Good, as well on the other side. And of course, looking comparatively from one side to the other, notating any differences in depth or anything that could indicate an abnormality in your rib health. So that does appear to be normal. Also going to just take a second to observe your breathing pattern. So looking at your breathing upon inhale and exhale, looking for any differences in depth from one side to the other, anything that could indicate an abnormality in your lung health. That does not appear to be present, so that's a good sign. So now just palpating along the mid-abdominal wall. These are your obliques. Very gently palpating down towards the umbilicus, feeling for any signs of hernia. So with strain or excess pressure, sometimes weightlifting or improper body mechanics, we can see hernias that tend to appear in this area towards the belly button. And I'm just palpating around to feel for any signs of abnormality there. So I do apologize if this is uncomfortable. I'm going to do a little bit of a deeper palpation, and this time I'm feeling around for your organs. Just feeling for any signs of inflammation in the organs. Also feeling your intestines, feeling for any signs of constipation or inactive bowels. And all of that does appear to be normal. Perfect. Okay. So what I'm going to do, Isabel, is go in with my stethoscope, and I'm just going to be having a listen to your abdomen, and this is just going to allow me to listen for any signs of abnormality that are not audible to my ear. So I do apologize, this instrument is very, very cold, so I'm just going to be placing this on your abdomen in various quadrants. And I'd like you to just relax and take some normal breaths for me. Okay. Very good. You're doing so well, just listening thoroughly, making sure I'm not missing anything. And now auscultating right above your intestinal wall. Listening to your bowel, and I am hearing active bowel sounds. It does also appear as if you've not eaten in the last few hours. Your stomach is growling, which is perfectly normal. I'm just going to listen directly above the umbilicus. Perfect, okay. All of that sounds completely healthy, so that is a very good sign of good gut health. So, give me just a second while I place my stethoscope back in the holder. Okay. So we're going to move on to a couple measurements of your abdomen and essentially just measuring for symmetry. So I apologize, this tool is very cold. This is just a measuring device that will allow me to assess for symmetry. So just adjusting slightly here. Perfect. Okay. So I'm just going to start by measuring the basic width of your rib cage. So starting here and following that down. Perfect. Okay. So going to move on to measuring vertically, and again just measuring for symmetry. And I don't expect this to be perfectly symmetrical, but I would like to see a base of symmetry. And so your belly button does appear symmetrical. Essentially just looking for symmetry among all sides and an even diameter. Okay, perfect. Okay. So of course at this point I am just going to perform a couple basic percussions of your abdominal wall. So you just relax, it's the same hammer that I used for your head exam. And just to start, I'm going to be percussing along your rib cage. Good. Perfect. Moving on to the lower quadrants. And directly over the umbilicus, listening for any obvious abnormalities here, which I'm not notating. So all of that does appear to be intact. So what I'm going to do at this time is test your abdominal reflex. And I'm going to test this by placing different textures, temperatures, variations on your stomach. And you don't really have to do anything. I'm just looking for a very specific reaction in the muscles of your abdomen, okay? So to start, I'd like you to just relax for me. Keep your eyes closed. And you're going to feel an object on your skin. Very good. So just looking for that natural flexing of the abdominal muscles. Very good. Very healthy reaction there. Again. Very good. Good job. Okay. I'm going to repeat that test with a different object. Just keep your eyes closed for me. Good. Good. Perfect. Good job. Perfect. Great job. You're doing so well. I'm going to move on by performing a series of that same sharper dull test, this time using different tools. And you just relax for me and again indicate whether or not you feel sharp or dull. This time I will be providing you with an example because the variations are less distinct. So this is going to be our dull. And this is going to be our sharp. Okay, so you just indicate to me which you feel. Sharp or dull. Good. Sharp. Dull. Very good. Sharp or dull. Good. Good. And sharp or dull. Good. Dull. Very good. And sharp or dull. Good. You're doing great. Sharp or dull. Perfect. And sharp or dull. Good. You're doing very well. Sharp or dull. Perfect. Sharp. Very good. Sharp. Very good. Sharp or dull. Perfect. Good job. And sharp or dull. Sharp or dull. Good. Sharp or dull. Dull. Good. Sharp. Very good. Sharp. Very good. That was dull. Perfect. So I'm going to switch to a different object here. And this time you're going to feel dull or soft. And I'd like you to indicate to me whether or not you feel the soft or the dull. Okay. Okay, so dull. Perfect. And dull. Good. Soft. Very good. Dull. Good job. Very good. And softer down. Perfect. Good job, Isabel. You are doing very well. Okay. So I believe that concludes our abdominal assessment with the exception of the measurement of your belly button. So what I'm going to do at this time is very gently place this object into the depth of your belly button, and then I'll be using my pen light to just measure, and we're just getting a baseline measurement here, looking for any signs of abnormalities or abnormal depth that can indicate an injury to the base of your belly button essentially, okay? So just relax for me. This test is a little bit ticklish, and I'm just going to go ahead and insert into the depth of your belly button here very gently. And when I hit resistance, I am going to lower my fingers down and remove. And then just using the measurement on my pen light to indicate how deep we are. So I'm getting a measurement about 1.5 inches. And just as good measure, I'm going to do that one more time. So just relax for me, just very gently. Meeting resistance and again about 1.5 inches. So that's a good indication that there is a healthy depth. So nothing to worry about there. So that does conclude our abdominal assessment.